Righty, all right. Okay, good morning, good afternoon, good evening, depending on when and where you're watching this Facebook Live. This is the voice and the face of Dr. Olabintan. I'm CEO and the co-founder of Livingspring Family Medical Center here in the awesome city of Mansfield, Texas. And I'm excited today to have conversations that help improve quality and quantity of life, because that's what we believe in here at Livingspring Medicals. And I am honored and delighted, you can see it, to have my friend, and breast surgeon Dr. Seyi Ojo here as a guest. Doc, how are you? And thank you for coming.
Good morning. Thank you so much for having me, Dr. Olabintan. It's an honor. I've never done this before, so this is a first. So thank you for that. Thank you for a
Oh,
first.
awesome. Thank you. Thank you for doing this then. I appreciate you. Now, for those who are watching, oh, before I forget, if you're watching live, hashtag live. If you're watching on replay, hashtag replay. But Doc, kindly introduce yourself. Who are you and what do you do?
My name is Ojo. I am a fellowship trained breast surgeon, and let me just explain what that means to the audience. A fellowship trained breast surgeon is a trained general surgeon who then goes on to specialty training, specifically in breast surgery, so that we care for the entire spectrum of breast disease. I practice in the DFW area. Mostly in the southern part of the DFW metroplex.
Awesome. Awesome. As I expected, you didn't say everything about yourself, but you can't, it's an exhaustive list. So I'm going to try to also capture some of that. So yes, she's a breast cancer surgeon. She does breast surgery for other types of diagnoses outside of that as well. Her personal response on a woman-to-woman basis provides patients with a comforting and confidence-building relationship for discussing all surgical options for each unique situation. As she said, she does have offices around, and she has an office in Arlington, Texas. And I have to be honest with you, I've watched you before. I got to meet you, and I love the way you interact with patients. And other things about Dr. Ojo that you may not know, she enjoys singing. She has a beautiful voice, and she's active in her church community. She's also a wife and a mom. You may wear many hats, so I wanted to give that shout out. Yeah.
Thank you. Thank God.
All right. Awesome. Awesome. So, Doc, why do you do what you do? We want to get to know, like, what's the why behind why you do what you do?
So I have to walk you back to how
Okay.
because it's tied to the why. Once I'm a woman of faith, and so I look at things through the eyes of faith. And so once I got the open door to get into medical school, and I got into one of the best medical schools in the country, I really kind of felt like the Lord was just kind of opening doors that, whether or not I had thought about it before, this was an opportunity for me to start thinking about. And so through medical school, I started to think about, what was I supposed to do? I had one intention going into medical school. And once I was there, I realized that I could just be a sponge and just kind of absorb so many different types of information, and then try to figure out where my niche was, where I felt most passionate about. And incidentally, that was surgery. I love to fix problems. If there's a problem, I love to fix it. It's the one unique thing about my personality, because otherwise I am actually an extreme introvert, but those close to me do not realize that, because I open up and blossom when I'm close to someone. But that particular part of my personality I discovered in medical school. If there's a problem, I love to fix it. I didn't like to kind of wallow in, okay, how else can we do this? I just wanted to fix the problem. And one of those things that allowed me to do that was the surgical specialty. I know I wanted to be a surgeon. So I went and did general surgery, because it gives the broad spectrum of different ways to be able to fix a problem. And it was during that training that I fell in love with oncology, caring for patients with cancer. And one of the few specialties, or I should be cautious not to say one of the few, but one of the specialties that allows us to be able to cure cancer surgically is breast surgery. Another thing about me is I love to get to know my patients, not just the reason why they're seeing me medically, but get to connect with them on a human level. And so one of the specialties that allows me to do that after I have fixed the problem is actually breast surgery, because I get to follow my patients over several years and keep up with them and ensure that they do not have a recurrence of their disease. So it was a long-winded, but my why was tied to my how. And so I love caring for breast cancer patients and patients, quite frankly, with breast disease, because it's one of those very personal things and it can be very disheartening. And I like to kind of sit down and go through the entire reason why something may have occurred, even beyond the initial presentation.
Awesome. Awesome. Thank you for sharing that. And it's beautiful how your skills and your passion tie into what you do. So beautiful, beautiful. Now, how often should we check our breasts and when should we start? We're going to go, before we start talking about lumps in the breast, but how often should we check our breasts and when should we start?
So for an adult woman, I would say, starting from the age of about 18 to 20, a monthly self-breast exam is adequate and sufficient. And I tell folks that when they're doing that, they should please be cautious to do it in two positions. Checking the breasts, whether sitting up and laying down with their arm lifted, and or checking the breast in the shower, and then in front of a mirror so they can see under their breasts as well. But the short answer is monthly.
Monthly. Awesome. Awesome. And I like that you showed how to do the different positions. And so my next question is, are lumps in the breast concerning? Because I have someone who's watching who's like, well, my breasts feel like a bag of lumps. So are lumps in the breast concerning? After all, they're all a bunch of lumps. Our breasts feel like a bunch of lumps. What would you say to that, doc?
So it's so interesting because I have this kind of conversation almost weekly in clinic. And there's some ladies who have what we call lumpy, bumpy breasts, so kind of fibrocystic breast changes. And even those ladies, I urge to get to know what their breasts feel like at baseline so that when there's something different, they can bring it up and ask me. The answer is sometimes lumps in the breast can be concerning. But interestingly enough, most of the time they're not. So let's just break that up into like age groups. So a younger woman who feels a lump in her breast, so younger, let's say less than 30, who feels a lump in her breast, the most common lump that she is feeling is likely a cyst. Okay. Now, most of those will resolve on their own. A younger woman feeling a lump in her breast, again, less than 30, if it's not a cyst and it's solid, then it's something called a fibroadenoma, completely non-cancerous and does not increase the risk for cancer. Once that age of 30, once there's that age of 30 and over, if there is a lump that's felt in the breast, I always encourage women to get it checked out. Still, the most common lump will likely be a cyst. Again, most common solid lump will likely be perhaps a fibroadenoma, which is again a non-cancerous lump. However, crossing that age threshold, there are more concerning lumps that they could be, and so they need to be checked out. And I should add here, I can't tell you how many women I've seen who did not know who to go to first when they felt a lump. So I should mention that start with your primary care physician. If you do not have a primary care physician, go to the emergency room, and then they can give resources to how to get in with the breast surgeon. If you have a gynecologist, start with your gynecologist, but the person should not sit at home ignoring that lump.
Awesome. And of course, these are medical suggestions. It's very important to schedule an appointment with your doctor to come up with a plan that's best suited for you. But very, very important to not sit on this and have this evaluated. And thank you for highlighting going to the ER. I didn't know you could do that to route if you don't have a primary care doctor. And this is, something you need to take care of.
Yeah. Sometimes they give them resources and places that they can then get connected to.
Awesome. Awesome. Next question. How soon after finding a lump in your breast should you see a specialist doctor? Is it an emergency, like you got to go in the same day? What would you say to that question?
It depends. Let's talk about, the infectious lump, right? The infectious lump in the breast needs to be seen as soon as possible because it could be mastitis that it could then lead to abscess, which is an infection. So those need to be urgent. A new lump that has not been felt before, within 1 to 2 weeks needs to be evaluated.
Okay. All right. So we work with trying to get such patients in sooner than later. So I have a client who had an imaging test done. They found a lump. What is typically next?
So
Like
the answer to that question is based on age grouping.
okay,
Okay. So let's talk through it for a patient or for someone who's less than 30. Still
okay,
lump, they've been evaluated. The first step for someone who's less than 30 is an ultrasound. Um, an ultrasound will typically evaluate that person, and if nothing concerning, then the radiologist gives recommendations based on that.
mm,
If there is something concerning, again, we're still looking at the age group less than 30. If there's something concerning, then the radiologist will likely schedule that patient for something called a core needle. That is a minimally invasive way of getting a sample of the lump and figuring out what it is. If
okay,
the patient is over 30, then the workup is a little bit different. The next step will likely be a mammogram. And after a mammogram, they may or may not require an ultrasound as well. And then subsequently, depending on what is nothing concerning, the radiologist gives recommendations as to how we continue to monitor that. If it's something concerning, then they give a recommendation and a plan for core needle biopsy. Now, some ladies, the lump for some reason cannot be biopsied at the bedside. Occasionally, that will be a surgical biopsy, but typically, the first step is a core needle biopsy, which is a bedside procedure that's a minimally invasive procedure. I want to back up to the lady that's less than 30.
hmm,
If the biopsy reveals something concerning, then a mammogram is done, and sometimes an MRI is required.
okay.
And I think we're going to segue to that because we may need to talk about breast density, but I'm sure we'll get to that.
Okay. So how do you advise patients prepare for a visit with you? Let's say they've done the steps, they had the biopsy, it is concerning, and it's confirmed. How do you and they're nervous about coming to see you to discuss what those results are and what next steps are. How do you advise such clients to prepare for a visit with you?
Um, you know, if it is something concerning, there are so many different resources online, and I advise them to please be cautious about those resources.
Okay.
Um, and really kind of recognize what the sources of those resources are. How did they gather their information? Was it based on research and data, or was it based on anecdotal information? Bless you.
Thank you.
So that is really critical because a lot of patients will tell me that they have read, and one of the first things I ask them is, "What did you read?" Because it helps me understand how I'm going to approach the conversation, the discussion with them. So yes, there are resources online. I typically recommend going to resources that are either set up by an academic institution and or an organized foundation that's focused on the specialty of breast diseases.
Okay.
Now, the second step is, that's the patient's personal educational resource that they are trying to gather their hand around before they get to the breast surgeon. The second thing is when they come for a visit, I encourage bringing somebody support, whether a friend, a spouse, um, a loved one. It is so critical because a lot of times the things that we're talking about at that first visit, they
Mm,
make you remember every single thing, and everything is really pretty important to remember. And so I always encourage that they bring someone of support, and it's something that is encouraged in my office. I welcome a guest with the patient because they're critical. The other thing I encourage is sometimes you do have patients who do not have family members around, and I always
mm,
give them the leeway. For my own practice, I allow folks to have at least one person that can call into the appointment
okay.
and be a second set of ears for them. The third thing is put questions down, write them down. There's certain things that people think they will recall during the visit that they do not because it's a lot of anxiety associated with a visit. So as they think up things, as they talk perhaps sometimes to people who may have gone through something similar with breast disease, I encourage that they write those questions down and even sometimes write the concerns down as well. So those are three main highlights.
Awesome, awesome. So bring in a friend or phone in a friend, writing questions ahead of time, have something even on a note on your phone, like questions for the doctor so you don't forget, and using guided online resources because bad news sells. We're not saying be unrealistic in your research, but it's more make sure you're getting the right information when it comes to your care. And I like that you have resources available to your clients as well. I'm going to segue a little bit into dense breasts. So I have someone who's watching who's like, yeah, they keep saying I have dense breasts. Is there something I could do about it? Does that mean that I have higher risk? Like, what are dense breasts and should I be concerned?
So the way I describe dense breast tissue is that when the breast is budding, when a young woman is developing breasts, there is a firm breast tissue that's being developed. But as people get older and develop also fatty deposits throughout the body, the breasts are one of those places where that is also deposited. Now, dense breast is looking at the composition of how much of that fibrous initial breast tissue is present and in relation to fatty deposits in the breast. The higher the composition of that fibrous tissue, the more the denser the breast is. The lower the composition, the less dense the breast is. Now, a composition typically about 50% or greater can be considered dense breast. Now, we do know that there is some slight elevation of risk for breast cancer in women with dense breast. And there is not known why. There's a lot of research going on into trying to figure that out. We think that there may be some biology associated with that. And I think more and more, once we investigate, we'll figure that out. But what should a woman do? Now, most people under the age of 30, most people under the age of 40 have dense breast tissue. I usually try to caution people about that. Screening mammograms should not start before the age of 40 anyways, meaning if there's no family history and no other reason why a woman should be getting a mammogram done, the age to start is the age of 40. Now, at the age of 40, if a woman's they're noticing that they're getting a report in the mail saying that their mammogram was normal, dense breast. One of the recommendations, a couple of recommendations, is one to consider ultrasounds once a year in addition to that annual mammogram, and it can be spaced out, and or a breast MRI can be a consideration. Now, for my patients personally, with no family history and no other indication to get a breast MRI, one of my recommendations is to add that additional ultrasound because it is a less than the breast MRI.
Awesome, awesome. And I'm glad that you mentioned the importance of doing your mammograms ideally after age 40, especially if there's no other risk factors. So I have someone who's watching who's like, I hear they squish your breast really tight. I don't want to do it. What would you say to that person who's watching now?
I would say that a screening mammogram occurs only once a year. It is the only imaging modality that has been found to decrease mortality from breast cancer. I will say that in simple terms. It is the only imaging test that has been found to decrease the risk for dying from breast cancer. So for a test that is done once a year, I encourage every woman to please bear with whatever that discomfort is once a year that could potentially make a difference in their lifetime.
I love it. Thank you so much. And one final question before I ask, where people can find you, because I'm sure people would like to know how they can connect with you, is, for someone who's gotten the news that the lump is concerning, and I know we talked about preparing, who's afraid, they're scared and they're petrified and they're like, it's like the world's, their world seems bleak. What words of advice would you say to that person?
I would say that to some extent, knowledge is power. And first, get informed. I couldn't tell you, a patient has come to my office. They've talked to different people who have had different journeys. And they have held on to those people's journeys as what is anticipated for their journey. And once they get informed about what's going on with them, there is a light that is shed on what they should anticipate. And I can't tell you how many times it has been completely different from what they've expected. And has a lot of times been what's expected to be more favorable than what they've heard and or researched. So one of the first things I always encourage is get in there and get the information from that medical provider that's specialized in doing and caring for that problem. In caring for that problem. Get in. Be careful where you get your sources of information. I know we've already talked about that before. Be open. I encourage my patients to be vulnerable in visits with me, because I say when they're home and they're with family, they're being tough, they're being strong. They don't want anybody worrying about them, so do not express what they're going through. So I call my office a safe space, and I intentionally want them to be vulnerable because I want to know everything going on, everything causing anxiety. I want us to put them on the table and really try to assess whether or not they're founded or not. And if they're founded, work through how we will manage and care for those problems that are causing anxiety.
Awesome. That's a power pack. That's a power pack. Your own journey may be different from the journey you've assimilated or you've heard of when it comes to breast cancer or a lump in the breast. Let me not just put that out there. But you're going to say something else before I cut you off. I apologize.
I think the other thing I wanted to mention is that if people have, whatever is an individual source of strength, draw on that, especially in that season. I can't say it, I can't emphasize it more enough. It's really critical to kind of go back and find what they have drawn on for sure in the past.
That's the part to assimilate. That's the part to assimilate from other people's stories and journeys. I love that. So Doc, I have people who are watching who are like, wow, I like this doctor and I think she's local to me and I would like to connect with her. Doc, where can people find you?
You mean physical address?
That's also good too. So they can come see you at the office. Yes, that works too.
So I have 2 office locations, one in Arlington, Texas, and the other in Burleson, housed in the Hughley Medical Center off 35. And my Arlington location housed in the professional building of Medical City, Arlington, right off of Matlock as well. Very easily accessible location. Also, my website, if you wanted to kind of get to know me a little bit more, especially more professionally, I have some videos on there as well, is thecentertx.com. thecentertx.com, and there's a specific link for my own page. And then if there's any questions, any subsequent questions after this, I also have an email that people can ask, send questions through. It's askthedoctor at thecentertx.com.
I love it. And we're going to share that information so people have access to it. And I'm sharing it down the screen as well so people can connect with you. They probably want you to have you come speak to their women's group about the importance of breast cancer screening or, different other topics, and actually come see you as a physician. So that information has been shared. Thank you so much for coming, Doc.
Thank you so much for having me. This was fun.
Yeah, this was good. Yay. And I look forward to having you maybe in 6 months, have you come back and answer more questions live for our clients and go from there.
Okay. That sounds good.
All right. Thank you so much. And for those of you who've been watching, I know we had a guest earlier. I'm not sure, Miss Yen. Thank you for joining us live. And if you or anyone you know is looking for an awesome, a thorough, and a passionate family physician in the Mansfield and surrounding area of Texas who will help you live long and well, I am she. Have a good one. Thank you so much, Doc. I appreciate it.
Thank you.